Welcome to the Clackamas County Public Health Division's Blueprint Community Grants webinar. I'm Armando Jimenez, Program Manager of the Center for Population Health, and I'm here with Susan Burns-Norman, the Blueprint Plan Coordinator. Thank you for your time and consideration as we work together to improve the health, safety, and well-being of our county. We're here today to review the requirements and provide information about the Blueprint Community Grants that will be released on October 12th, 2021. But first, I'd like to share some important details about Clackamas County Public Health, describe our vision, which is a vibrant and healthy Clackamas County, and our mission, which is to protect and promote the community's health by advancing racial equity, building partnerships, and establishing culturally responsive systems. And now I'd like to introduce Susan.
Thanks, Armando. I'm Susan Burns-Norman, Blueprint Plan Coordinator for Clackamas County Public Health. I'd like to briefly cover information about our blueprint for a healthy Clackamas County. The Blueprint Plan is our county's version of the Community Health Improvement Plan, or CHIP, that is required for all public health divisions nationally. The first Clackamas County Blueprint Plan was done in 2012 and updated in 2017 and again this year. The Blueprint Plan includes an assessment of current local and state data trends and is referred to as a Community Health Needs Assessment, or the CHNA. How is the plan created? Local residents, staff from schools, and human service organizations, county human service directors and staff, and representatives from high priority populations are then brought together to discuss goals, objectives, and strategies to improve the health and well-being of our county. The goals and objectives are community-driven through an inclusive and extensive process. How will the plan be implemented? One way to address these goals and objectives is through community grants. Another way to implement the community's goals is by bringing people together to further act on the priorities outlined in the Blueprint Plan. Also, advocacy on specific topics and education-related awareness activities may be conducted.
Clackamas County Public Health will be releasing the Blueprint Community Grant on October 12th. The aim of the grants is to invest in community-level interventions that are focused on improving community health and well-being by reducing health disparities. Proposals should focus on reducing health disparities within high-priority populations, addressing social determinants of health and improve racial equity, address gaps and needs of under-resourced and marginalized high-priority populations, address the impact of COVID-19 on high priority populations, support trauma-informed approaches, and build capacity through strengthening relationships and partnerships between organizations and the high priority communities they serve. What groups of individuals are considered to be a high priority population? The list here includes Black, Indigenous, and people of color, low-income, economically disadvantaged communities, people with disabilities, people with severe and persistent mental illness, those living in rural communities and under-resourced, houseless individuals and families, aging and older adults, LGBTQIA+ populations, and populations that are impacted by inequities impaired by racial and social injustice, COVID-19, and/or the recent wildfires and climate change events. Specifically, I would encourage you to review the RFQ document for the entire list.
The total amount of funding available for award is $400,000. Proposals can be written for the time period of December 1st, 2021 through June 30, 2023. Funds must be expended by June 30, 2023. Contracting will be for the entire duration of the grant or a shortened period per the application. There are two levels of funding: Innovation Grant, which is $2,500 to $50,000, an Impact Grant, which is $50,000 to $75,000. Who is eligible for a grant? 501c3 community-based organization, a for-profit organization, faith-based community organization, small businesses, schools. Those who are not eligible are individuals or county divisions.
An organization may submit multiple proposals, one application per objective focus area. There are 12 focus areas, 6 mental health related focus areas, 4 related to culturally preferred healthy foods, 1 related to chronic disease prevention and planning, and 1 related to dental access and benefit utilization. I will give you time to review these, but I encourage you strongly to review these focus areas on the RFQ document.
Why is Clackamas County releasing a request for qualifications rather than a request for proposals? Typically, an RFP allows the applicant to propose strategies with varied projected outcomes. For this current bidding process, Clackamas County Public Health has elevated input from the community about strategies that would have the most impact for our community. The objectives and strategies found in the RFQ are based on current trends, local data, best practices, research, regional health disparities, and a large degree of community input from the diverse groups and individuals. Through this bidding process, we are asking organizations to implement the objectives and strategies outlined in the RFQ. Public Health has worked hard to make the RFQ accessible and easy to complete. The sections of the RFQ include project description, how well the proposal will address health disparities impacting high priority populations, a timeline and work plan, an evaluation, budget, and sustainability. Requirements and reporting. We ask that the awardee work in coordination and as a partner with Clackamas County Public Health Division on initiatives and activities. Be an active participant on a Public Health Advisory Council standing committee. Emphasize collaboration, relationship building, and other organizations in your project through capacity building. Reporting will be negotiated between the awardee and the county based on the start and end date of the contract. Typical reporting requirements include a quarterly or 6-month budget and work plan update report, a midway or final report, and periodic updates with FAC, our Public Health Advisory Council, and its standing committees.
Here are the important dates for Blueprint Community Grants process. The funding will be announced formally on October 12th, 2021. The webinar that we are talking through here will be posted on blueprintclackamas.com regarding the grant opportunity on October 12th, 2021. The last day to request technical assistance via the blueprintclackamas.com website will be October 26, 2021. The due date for the applications will be November 2nd, 2021 at 5 p.m. And the start date, the project can begin the date of the award letter, projected to be December 1st, 2021. And all projects must be completed, and the funding will end June 30th, 2023. You will find all of the information related to the Blueprint Community Grants at blueprintclackamas.com. While at this website, you will also find county, state, and national data. This particular webinar will be posted on the website. There will also be a frequently asked questions document, a question and answer log with all of the technical assistance questions that will be posted. We ask that you register to be a user so you can receive alerts and responses on questions and answers, examples of successful funded projects, and future funding opportunities.
After the release of the RFQ on October 12th, through November 2nd, all technical assistance and grant-related questions must be entered on blueprintclackamas.com. This step ensures that all applicants receive the same information. If you have general blueprint plan or public health related questions, please reach out to me at this email or phone number, susanb@clackamas.us, 503-936-2415. On behalf of Armando Jimenez and myself, thank you very much for your time and consideration regarding this exciting grant opportunity. Good luck and be healthy and safe.